Hello, this is Jenny Hosbach, the Director of Training and Education for Practice Transformation Institute, and Ruth Clark and I welcome you to Session 0, the Community Health Worker Program Explained. So we're going to go over all the things that you need to know about the program as you decide whether or not you want to engage with us in this community health worker education. So when we welcome folks, we ask them to sign in using the link in the chat box and to plan on attending the entire session. PTI uses active learning strategies which encourage learner participation in addition to question and answer opportunities. So what do we mean by that? Anytime we present a program, we focus on the learner, and we want to make sure that we use teaching learning strategies that engage the learner so that when this program is over, you don't have questions. We want you to have clarity, and so we want you to communicate with us as you hear content. If you have any questions, we want to make sure we are clear and understandable, and the information we share with you is of use and benefit to you. So please ask questions anytime during our presentations and seek clarification whenever you have a concern. Also, we have found in teaching for many decades that there is so much wisdom in our learner population that we'd like you to share that by giving feedback to not only your fellow participants, but to us, because you have experiences that can help provide examples of practices that you have engaged in. So we use virtual etiquette because this is a virtual program. So we expect cameras and microphones to be on if able, and you can use your raise hand function, or you can use the electronic raise hand function on a little blue hand. You can use the chat function. We have someone always monitoring the chat function. And when you have a question, just unmute yourself and ask. It's important that you have your questions answered. We want to make sure that our backgrounds and surroundings are clear and that you position yourself in the light so that you're not in the dark background. So who are we? Practice Transformation Institute was founded in 2007, based in Southeast Michigan. PTI is a 501c3 nonprofit organization that provides continuing medical education, or CME, and international accreditors for continuing education or training, which is IACET. These accredited learning programs have been earned by PTI, and we focus on implementing the multiple principles of the patient-centered medical home and other primary care transformative initiatives, such as teaching the community health worker program. Our mission at Practice Transformation Institute is to use proven learning methods and business education strategies. We empower physicians, advanced practice providers, and their medical office teams, and the greater healthcare community through training programs that are customized to fit each group's needs. PTI exists to inspire and assist individuals and organizations to improve how healthcare is delivered in their communities, in the state of Michigan, and across the country. I mentioned IACET. What is IACET? IACET is an organization that we sought accreditation from many years ago. PTI is accredited by the International Accreditors for Continuing Education and Training, and we offer IACET CEUs for learning events that comply with the ANSI or IACET Continuing Education and Training standards. It's important to recall or remember IACET is recognized internationally as a standard development organization and accrediting body that promotes quality of continuing education and training. I would be remiss to not tell you, this was a rigorous application that we did, I don't know, I think about 15 years ago for the first time, and we were approved, which makes us a bit unique from other training and learning and training organizations. The Michigan Department of Health and Human Services has approved our CHW program. PTI's Community Health Worker Program is approved as a provider of community health worker curriculum by the Michigan Department of Health and Human Services. PTI's CHW program complies with the requirements of the CHW Core Consensus Project, and you will hear more about that later. It's called the C3 Project. So we ask people, what are the definitions of a community health worker? And they're pretty varied, but let me give you some that come from the national scene. The National Institute of Health developed their definition 10 years ago, and they still hold by it. Community health workers are lay members of the community who work either for pay or as volunteers in association with the local healthcare system in both urban and rural environments. CHWs usually share ethnicity, language, socioeconomic status, and life experiences with the community members that they serve. Another definition, again, 10 years old, but they still use it, is from the American Public Health Association, and they define a CHW as a person who is a frontline public health worker who is a trusted member of and or has unusually close understanding of the community served. They serve as a liaison or a link or an intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competence of service delivery. Now, taking many definitions into account, our program's definition or description is that a CHW is a member of the community who serves as an advocate and liaison to connect individuals and their families to healthcare and social services. They have a strong connection to the communities they serve. CHWs may share the same ethnicity, race, language, socioeconomic characteristics, cultural practices, spiritual beliefs, and life experiences as their community. CHWs work in urban and rural environments and with low-income, minority, immigrant, and underserved communities. They have diverse job descriptions as well as job titles, depending on the organization in which they work. Now, before we move on to talking about the roles and responsibilities, I want you to take a look at this definition because you can see the significance of what a CHW can do. A CHW makes an amazing difference in the population they serve and in the individuals that they work with. Know that you are engaging in a role that is critically important to our healthcare system. So a little bit of history. The first community health workers in Michigan were trained in the 1960s to provide services to their communities. Around this time, the federal government began providing funding for community-based programs that use CHWs to reach underserved communities. Community health workers in Michigan and across the country began having an impact on the national level when in 1978, CHWs formed the new professionals special primary interest group in the American Public Health Association. This group was renamed the Community Health Worker Section in 2001. From its inception in 1978, this group promotes the community's voice within the healthcare system. In 1983, MHP Salud was formed to address the needs of the migrant farm worker population in Michigan using the community health worker model. So all of that being said, what are the roles and the responsibilities of a community health worker? And why is their role increasing? There has been significant recognition of social determinants of health and behavioral health needs in the population we're serving. And we know that social determinants of health and behavioral health needs impact overall health. So we engage CHWs in screening for social determinants of health and behavioral health screening. They focus on the individual and the community's health. Why is it increasing? Because the need for increased health access exists within our communities. There's growing diversity in the USA's population, and unfortunately, a growing prevalence of chronic diseases. We also know that there is an advanced acuity of patients with chronic conditions. And what does that mean? The severity of their illness is increasing. We also know that our population is aging, and we also know that our healthcare system is getting more and more complex. CHW's role is to have a commitment to work with populations to reduce health inequities and to work to deal with the cost pressures that exist in the healthcare system. We also know there is a shortage of clinical personnel limiting time with patients, but a CHW has an opportunity to spend significantly more time with patients and to hear their story and to get more background about them. So we know that adding a CHW to the care team is increasingly valued. If you look at this circle, you will see a lot of things. Now, we did not create the circle because if PTI created the circle, it would have spelled positive correctly, but we didn't create it. But what are the CHW qualities? Well, the first one is interpersonal skills, kind of like warmth, such as empathy, the ability to listen and to respond to people and communities with both compassion and kindness. Trustworthiness, being honest, allowing others to confide in you, maintaining confidentiality, and upholding professional ethics. Many years ago, an author by the name of Stephen Covey wrote that at the personal level, you must be trustworthy if at the interpersonal level, you want to be trusted. At the managerial level, you want to be empowered, and at the organizational level, you want to be in alignment. And why do I bring that up? You want your people that you are serving to trust you, but you first have to be trustworthy. The next one is open-mindedness, the willingness to embrace others' differences, including their flaws, and to be non-judgmental in our interactions with them. None of us in healthcare are here to judge. I am a nurse, and Ruth is a nurse, and between the two of us, we have practiced over 100 years. And I can tell you, not once did we ever judge a person because that's not our job, nor is it yours. The next is objectivity, striving to work and view clients and their circumstances without personal bias or personal prejudices. We need to be very objective when we work with patients, and we cannot make assumptions that we know what their journey is like. We need another trait of sensitivity, to be aware of and truly respect the experience, the culture, the feelings, and the opinions of others. And how do we do that? By listening to their story. Competence, developing the knowledge and the skills required to provide quality services to all clients and all communities that you work with. We have a commitment to social justice, the commitment in the heart to fight injustice and to advocate for social changes that promote the health and the well-being of clients and communities. Next is good psychological health. Have the mental and emotional capacity to perform your work professionally without doing harm to clients or to colleagues or to yourself. And lastly, self-awareness and understanding, being willing and able to reflect upon and analyze your past, your own experiences, your stories, your biases, your prejudices, to ensure that they don't negatively affect your interactions with clients and colleagues. And it has been very well known that most of us have unconscious biases that we're not even aware of, and they tend to pop out when working with patients and communities. So we have these qualities that exist within the CHW. You can take a look at all these words and ask yourself, which ones pop out to you? Which ones fit? Why you want to engage in the CHW role, and what qualities you have that indicate you're ready and willing and able to do so. So what are some of the proactive roles of a CHW? A CHW builds on an individual's health knowledge and self-sufficiency through activities such as conducting patient or client outreach, follow-up, navigation through this complex system of ours. Another role is to coordinate care between individuals, healthcare providers, and community organizations. Supporting behavioral health by coaching and using motivational interviewing techniques, which you will learn about in this program. Another role is providing social support, including informal coaching, counseling, and advocacy. Promoting understanding and self-management of chronic conditions. Always remember, you could be an expert in a disease, but the patients are an expert in the illness that they deal with. And lastly, performing health screenings and disease prevention activities so that we can improve health outcomes and reduce disparities. CHWs build on an individual's health knowledge and self-sufficiency through things such as cultural mediation among individuals, communities, and health and social service systems. System navigation. We've already talked about the increasing complexity of our healthcare world. Implementing individual and environmental assessments and advocating for individuals. Those are very important proactive roles of a CHW with individuals but we also have CHW roles with communities. CHWs build on communities' health knowledge by supporting and organizing community outreach activities, finding out what the need is in the community that you're serving, and do an outreach activity. Providing culturally appropriate health education and information. Building trust within the community through access to culturally competent services. Identifying culturally and linguistically appropriate healthcare providers and community liaisons. Another is working with state and local social services organizations to navigate the healthcare system and connect community resources. It's critically important that we in healthcare find out and use appropriate community resources to help improve the care that we provide to our clients or patients or communities. Another proactive role of a CHW is working as a link between healthcare providers and the community, and conducting community assessments and advocating for communities. When we look at all the different roles of a CHW, we should look at all the different titles. If you look at this particular slide, you see things like camp health aide, case management aide, community care coordinator, community health advisor, community health navigator, community health representatives, community liaison, organizer, community support worker, family service worker, human service worker, lay health worker, life skills counselor, outreach educator, peer health promoter, peer health educator, peer navigator, a promotora, or a social work assistant. Now you ask, what is a promotora? That's a lay Hispanic or Latino community member who receives specialized training to provide basic health education in the community without being a professional healthcare worker. So you can see these are many different titles, and there may even be many more. But depending upon your location of your work, the title may change. So let's look at some of these locations. Your job location might be a community-based organization. It may be within a local health department or hospital or clinic. Maybe it's within a health insurance company or a nursing home or a senior center. It could be within a primary care provider's practice or within a specialty practice. So you can see there's a lot of different locations that you can use your role as a community health worker. So knowing all of this, what do we expect? What outcomes do we expect for our services? These outcomes are very important. Enhance communication and understanding between community organizations, social service systems, and healthcare providers. Another outcome is to increase access to and appropriate use of healthcare services. Many people, unfortunately, don't have access. We work with them to provide that. Raise health-related knowledge and healthcare screenings. And we find another outcome is improved adherence to health recommendations. Another outcome of CHW's work is to promote self-care practices and healthy lifestyles behaviors. We can tell a person what to do, but it doesn't work. Changes must come from within them to make lifestyle changes and to promote better self-management of themselves. And another outcome is realizing overall cost savings within the healthcare community. So we've talked about what we do, who does it, what are they called, where can they do it? So now I want you to hear from Ruth. So Ruth, would you introduce yourself and you will be hearing from Ruth some of the challenges of being a community health worker.
Thanks, Ginny. I'm Ruth Clark. As Ginny has mentioned, I've had the privilege of being on the team that's developed the curriculum for the CHW program, as well as I'm one of the educators. And as Ginny mentioned, we're both nurses, and that over 100 years of nursing, she usually tells us that it's because we went to nursing school right out of preschool. I sometimes say right out of the cradle. But it's beginning not to matter no matter what. We're just old, right, Jenny? So healthcare can be challenging. Anytime you work with people, it can be challenging because people bring in healthcare, and for you as a community health worker, they might come with the worst day of their life. They don't have some of the things that they need. And you'll be a detective trying to help find those things that they need. Sometimes you'll be helping them identify what it is that they need because they don't really know, or helping them realize that within them exists the ability to make changes that they didn't think they'd be able to make. So along with the challenges, I hope Ginny's conversation has helped begin to get you excited about the possibilities that come with working with people and with helping other people. So some of the challenges that we currently have: lack of reimbursement for community health worker services by many of the health insurance companies is one of those. Now, we are seeing changes there. We do know that with particular services that are rendered, some of the health insurance companies are paying for those, and Medicaid, we'll talk about in a little bit, has begun to pay for some of those services as well for individuals who are educated within the community health worker program. It's been difficult in some areas for CHWs to be recognized as legitimate providers or members of the healthcare team. And that's not uncommon in healthcare. When a new team member is introduced, a lot of times there's not an understanding of what that person does. So part of what education does around community health worker programming is to help providers, other members of healthcare team, those in social services, recognize the value that community health workers bring. And as Ginny talked about, some of those things that you do bring to the table and how important your role is. The standards and requirements differ across different organizations and states. We'll talk about the core consensus project that's hoping to address some of that. But regardless, states still are able to set their own requirements and standards. And so if you move from one state to another, there may be a little differing requirement there. So community health worker services are formally allowed under the Affordable Care Act. And when you look at when that was signed back in 2010, we're 14 years after that, and we're finally beginning to see a real push and a real look at the value of community health workers here in Michigan. Each state is able to create policies related to their CHW functions, which I had just mentioned does create some challenge. But effective on January 1st of this year, Michigan Medicaid fee-for-service, Medicaid health plans, so those would be the Medicaid HMOs, and integrated care organizations pay for specific community health worker services that are performed by approved community health workers. So there are some requirements that a community health worker must have regarding education and or training at this point in order to be able to bill for those services. The health plans and the integrated care organizations may develop some prior authorization requirements that differ from Medicaid requirements. So you can see even within the state, there may be some differences in what you're allowed to do with or without prior authorization. Now, Blue Cross and some other payers do reimburse for specific services filled by community health workers who complete approved training and provide services in patient-centered medical home practices. Those are primary care physician practices that Blue Cross has designated as a patient-centered medical home. And in addition to the curriculum that's designed specifically for CHWs, Blue Cross requires a one-day training in team-based care, which helps the CHWs see how the team works together. Grant funding still provides some level of reimbursement for community health worker services. So in particular, social service organizations, other nonprofits that may want to engage community health workers may be applying for grant funding to help cover that. So both Ginny and I have mentioned this C3, the CHW Core Consensus Project. This project was put together, an organizational program to define the comprehensive roles, skills, and qualities of community health worker. Those things that Ginny talked about earlier in this presentation. It establishes a national consensus. Now, consensus doesn't mean that everybody has to abide by that. But these are the things that different organizations that have community health worker engagement, and they are pushing for the use of community health workers. They have come together to decide together how community health workers should be able to practice, what policies might need to be in place, and how can there become a greater understanding of the full potential of a community health worker. So we think about this C3, it helps to address several of the challenges that I mentioned earlier. So as Ginny mentioned, PTI's Community Health Worker Program meets all of the competency requirements of the C3 project, which allowed us to obtain the Michigan Department of Health and Human Services approval for the program. There are 11 core competencies, and within each of these core competencies, there are sub-skills. So this is just a brief picture of some of the areas, and then within each of these competencies, part of what we were required to show was that our program met all of the sub-skills. So communication skills, critical in any kind of helping profession. Interpersonal and relationship building skills. How do you deal with conflict, for example? Service coordination and navigating skills. How do you connect people to the services that they need? Capacity building skills, both from an individual professional capacity building within oneself, and how do you build capacity within a community? So you may be assessing a community and finding that they're lacking in certain areas. How do you approach others within the community to begin to build those skills and abilities? Advocacy, both on the individual level for your individual client or patient, as well as on the community level, advocating for things to improve what's going on within the community. Education and facilitation skills. So you learn about chronic conditions, for example. How do you share that information with others, perhaps in a small group setting, as well as with the individual? Individual and community assessment skills might include environmental assessment of that person's home situation. It includes things like social determinants of health assessments, perhaps a depression screening, anxiety screening. Outreach skills, being able to help outreach and connect people to services. Professional skills and conduct, evaluation and research. How do you find what's going on in your community so that you can help address some of those issues? And then knowledge base, which is a bucket where things like chronic disease, substance use disorder, mental health disorders are included. So very, very robust program. For Practice Transformation Institute, we have enhanced some of those areas of focus, some of those competency areas, because as we look at the things that can help a community health worker be their best with their patients or clients, we think there are some things that are particularly important to not just address, but to enhance the areas of focus, spend some more time. So behavioral health, substance use and disorders, we spend 2 full sessions on those. Chronic conditions, again, there we spend 2 full sessions on chronic conditions that are common to our communities. Cultural competency is a thread throughout where we look at what's the impact of that. Documentation. Documentation is critical. One of the things we learn in nursing school to start out, if it isn't documented, it wasn't done. So where do you document that? How do you document? What are some of the tools you can use to help you document completely? Health coaching. So looking at some of those areas, how do you live a healthy lifestyle? And we spend an entire session on healthy lifestyles. Health equity and health disparities is another area that is woven throughout the program, and especially as we look at healthy lifestyles, health promotion and prevention, chronic conditions, behavioral health and substance use disorders, we specifically address some of those issues that are related to health equity and health disparities within various communities. Health literacy, part of our look at public health and the importance of health literacy as we're working with clients and patients. Health promotion and prevention, again, we spend an entire session on that, looking at some of the important preventive services that need to be done to help address some of those health inequities and health disparities. Motivational interviewing. We spend 2 full sessions on motivational interviewing, learning different ways to talk with patients and clients and how to help them identify how they can solve their own problem. We don't solve problems, we help facilitate that. Navigating health insurance. So what are the different kinds of health insurance? What do all those terms mean? And then social determinants of health, again, is woven throughout. We do have sections of sessions on that, as well as weaving that concept throughout, because the social determinants of health are those things that individuals struggle with on a day-to-day basis, and that community health workers are key in helping making those connections. So we mentioned the Michigan Medicaid policy that became effective January 1st. And so within that, in order to meet the criteria that allows an individual who is connected to a provider in some fashion in order to bill for services, the person must be 18 years of age or older, must have at least a high school diploma or high school equivalency diploma or certification, must meet the CHW training program pathway, which is PTI's program is approved as part of that, as the pathway that can allow for that reimbursement. Within the first 24 months of the Medicaid policy implementation, so through 2024 and 2025, temporarily they are allowing a work experience pathway, and that's better spelled out within that policy bulletin. But by the end of that time, the person must have gone through the training program pathway in order to continue to qualify for reimbursement. Must have successfully completed a community health worker application with the Michigan Department of Health and Human Services designated contractor, and must be listed in good standing on the Michigan Medicaid CHW registry. That happens after meeting that training pathway. And then complete provider enrollment requirements that are detailed in that policy as well, which we aren't taking the time today, but which is discussed in more detail in the program that PTI offers. State of Michigan requires and recognizes those 11 core competencies that I mentioned with the C3 project as necessary for the CHW training and educational program. Had we not met those, we would not have been approved, but we met those with a very high score, and are really happy to be able to provide this program that we believe is of the highest caliber. CHWs will be required to maintain a minimum of 6 hours of continuing education through an approved training program annually. So in order to keep that knowledge base going, it's really important to continue to learn. And an internship experience is an asset for entering the field, and we do have that opportunity within PTI's program. So if you think of questions as you've gone through this and you're listening virtually and we're not there to answer those questions real time, please feel free to send in those questions, because we want to reach out and want to be able to answer any questions that you have. So let's look at what this program is. To obtain the program certificate, there are 103 hours of instruction. That instructional time is virtual. It's all via Zoom. And so you're able to do that from a location that's convenient for you. 25 hours of homework, roughly, required with a weekly due date. Some weeks it might be a little bit more, some weeks it might be a little bit less, depending upon the requirement there. A 40-hour internship. This can occur if you're in a practice or clinic, if you're in a healthcare organization or in a community setting already, and you can talk with your supervisor or manager about that and get that approved. You can have that internship occur there. If you're unable or you don't have an internship availability, we will try to help get you connected to an organization who's willing to work with you on that. So the program in total is 168 hours. This is the program calendar for the upcoming cohort, which begins in September. The first date, September the 17th. As you can see, the different topics here, community health worker basics. So giving you an overview on that first day. Communication, part 1 and 2. A lot of great information about what is it that we mean by communication. What are the parts of communication? One of the pieces that people really enjoy, and Ginny does both of these sessions, is generational differences. And how do we talk to people? How do we listen differently to people of different generations based on what they bring to the table? I do the sessions on motivational interviewing, parts 1 and 2, where we learn about some of the tools that you can use with motivational interviewing. Then ethical and legal concepts. The week of Halloween, we want you to have the opportunity, if you have family and other or children that you need to do some things with, we take that week off to allow that time. Assessment and interventions. Documentation. The next week is professional capacity building, so that's on the individual level. We take the week off of class for Thanksgiving. Then community capacity building, public health and health literacy, healthy lifestyles. We don't have class the weeks of Christmas or New Year's. We have then screening and prevention, 2 weeks of chronic conditions, 2 weeks of behavioral health and substance use disorder, navigating health insurance maze, the morning of that 18th session, and then what we call putting it all together in the afternoon, where we have case studies in which there is directed discussion and role playing. And really the idea is to, when you get that patient or client in front of you, what do I do? Having you feel confident as you walk out And then the last day, which is a very short day, but is graduation. So as you can see, 18 weeks of classes. They are from 9 to 4 each day, and with a couple breaks in the lunchtime, and then the final few hours of graduation, where you're able to ask a couple people that you might want to share in that exciting celebration. So what do we require of you as Practice Transformation Institute coming into this program? Consistent with Michigan's requirements, 18 years of age or older with a minimum of a GED or a high school diploma. We'd like you to have some effective communication skills. Now you're going to get 4 weeks of communication right up front, and we'll be practicing all of that throughout. But you should have some basic communication skills coming in. Also some basic computer skills. We use Google Classroom. That's where your homework will be provided. That's where post-session tests will be. So you need to have some basic skills. Access to the computer and the internet with audio and video capabilities. We like to see your faces. We want to hear your voices. So the audio and video is an important part for us, if at all possible, that you can have that video on. You certainly will need audio capability. Completion of the 168 hours of training. We have the virtual sessions that I mentioned. We do case studies several times. We do role playing. Homework is assigned with each class. This particular cohort as Tuesday classes, so your homework is due weekly on Saturday at midnight, so that we have an opportunity to review that and get you feedback before the next session. You have the internship, a weekly session evaluation. That's you're evaluating us. We want to know where we're hitting the mark, where we're missing the mark. How can we improve? We're always looking for improvement. And then we evaluate your knowledge as well through the homework and then through a weekly post-session test. Not anything that's rigorous. It's like 7 questions, but it's due by Saturday at midnight as well as your homework. In order to earn that certificate, you must be present and actively participate in all of the sessions. Both Ginny and I mentioned, we want to see your faces, we want to hear your voices. We want to learn from you as well. Learning from each other is critical in adult learning. You must miss no more than 2 sessions. So look at that calendar so that you can see, am I able to meet the requirement? If a session is missed, we understand things happen. People have family things that come up, or sometimes an illness. Then to make up that session, you would listen to the session recording. We do record each one and turn in a 1-page summary of the key concepts and how those concepts may be applied in practice. Now, if you do listen to the recording, you don't qualify for the continuing education credits for that particular session, but you do need that to get the program completion certificate for the entire program. For ISF, this must be virtual live session. Complete and turn in all your homework assignments by the due date and time, which is Saturday at midnight for this particular Tuesday cohort. You must complete all post-session tests with a passing score of 70% or greater, and that must happen by Saturday at midnight. Now, if you don't pass it the first time with 70%, you are able to retake that test until you're able to get the 70%. So we really want you to be successful here. And then submit the completed internship practical log and assessment tool by the due date and time. And we'll be able to provide you with more information about that due date and time early enough within the program as you're going along and wanting to document which of the particular areas within that log that you have completed. So why? Why do you want to do this program? Professional recognition, the opportunities for professional growth, increasing personal and interpersonal skills. We all can do better there. Improving your self-efficacy, your confidence in yourself. Utilization of screening and assessment tools. You may be providing the screening yourself for assessments, or you may be noticing those if you're working in a practice or in another organization. What do these mean? So this helps you identify that and be familiar. An introduction to the challenges of patients' experience with common chronic conditions within a primary care setting. So what is the background around chronic conditions? What do I need to be looking for? How can I help my patient or client set a goal so that they can have a healthier life? Gaining familiarity with issues surrounding behavioral health and substance use disorders. Again, so common and increasing, it seems, in our world. Navigating community resources. Part of the homework is identifying community resources of various types and developing a directory that you will have at the end of the program so that when you are working and you need a community resource, you already have at least a beginning guide for that. Organizing community health activities such as health fairs, advocating for a person or a group, and then identifying what are those resources that can improve the well-being of the community. So both the individual level, as Ginny mentioned earlier, and at the community level. That's the community health worker. So we hope that you're excited for the opportunity to participate. We very much would like to meet you. What do you do in order to have that happen? Complete the community health worker application that you can see the link here. The registration and payment, the cost for the program is $1,195. And that's the entire 18-week program. Homework review for you. We have office hours available. So really a lot of information and opportunity there. There are some additional session 0 dates if you wanted to participate live. That's a possibility as well. Or you can send any questions, this same link here to Yang. She will connect us if need be to you to help answer your questions, or she's a great resource in answering them as well. So capacity is limited. So we hope that you will engage with this and that we'll be able to meet you and you'll be part of our next cohort. Ginny, do you have something you'd like to add?
We certainly welcome you. We know from our last many cohorts that student satisfaction is very high with our program, and that they definitely exit our program different than they enter it. And they feel valued, and they find out that their new role is very valuable. So please consider becoming a CHW, because you will make a difference in this healthcare community, and you will make a difference in people's lives. So we hope you consider PTI's program as well. And Ruth and I, 2 nurses, we teach a significant portion of those courses, and we look forward to seeing you there. Please get a hold of Yang with any questions, as Ruth said. And again, thank you for listening.
Thank you. We hope to meet you soon.